So thank you for joining us today. I am Joan Benz. I'm the Program and Administrative Coordinator for Sharp Again Naturally. And I want to welcome you to today's May webinar. Please note the information in this presentation is for educational purposes only and does not constitute medical advice. Our information is intended to empower individuals, their families, and healthcare professionals who want to coordinate and collaborate in the most effective ways on this journey to health and well-being. Please see a licensed and qualified medical professional for your medical needs. Before we begin, I'd like to share a Stay Sharp programming update with you. Registration will open soon for our next Stay Sharp Foundational Coaching Program, which begins on Tuesday, July 6th. This program offers a unique opportunity for those looking to preserve their cognition or who are just beginning to notice lapses in their memory. Participants work closely with a professional health coach and are bolstered by peer support in a secure, supportive setting, which is online and enables them to identify and begin to modify lifestyle factors that may be impacting their brain health. The program includes 2 private consultations with a health coach, 6 75-minute coaching calls via Zoom, a comprehensive manual and workbook to help you stay on track, and access to a third-party online assessment to measure core elements of your cognitive function. Each 6-week program is limited to 8 participants. I was speaking with a participant in a recent program, and he said his favorite part was that it focused on 4 topics: nutrition, sleep, exercise, and stress. He said that you get a taste of everything, time for it to sink in, and then you use that knowledge to make effective changes. He highly recommends it to others because it provides a real foundation for a healthy rest of your life. Our summer and fall webinars will begin in July, and we'll have those posted soon. Thank you for joining us, and I'd like to welcome our speakers, Dr. Robert Kachko and Debbie Drelich. Dr. Kachko is a founder of the New York Center for Integrative Medicine, offering his patients a truly holistic approach to healing. As a naturopathic physician and licensed acupuncturist, he combines cutting-edge advances from modern medicine with time-tested traditional approaches to healing. Dr. Kachko has received additional training and certification in multiple mind-body medicine approaches, including somatic experiencing, clinical hypnotherapy, biofeedback, functional neurology, and biopsychosocial pain management. He is a clinician, first and foremost, and an advocate for healthcare reform who believes strongly that every American should have access to the kind of care he provides. Debbie Drelich is the founder of New York Elder Care Consultants, LLC, an aging life care consultation practice that provides assessment, advocacy, and care management of older adults. She has seen firsthand the challenges faced by clients suffering from dementia and their caregivers. Debbie received her master's degree in social work from the Hunter College School of Social Work, as well as post-master's degree in individual treatment, a certification in healthcare administration, and a certification as a health coach from the Institute for Integrative Nutrition. If you have any questions, please type them in the chat box and we will answer them during the Q&A at the end of the presentation. Please welcome Dr. Kachko and Debbie Drelich.
Thank you so much, Joan. Oh, I'm hearing saying, okay, you can hear me, Debbie? Okay, I'm getting some signals. So I'll give the disclaimer that I just gave Joan and Debbie a couple hours ago. I have COVID, I'm on day 4 of COVID, and COVID brain is real. And so I will do my best to make this as engaging as possible for you. But if you see me drinking my throat coat tea or blowing my nose, please excuse this. That's something that we're all eventually going to deal with. So this topic of social isolation is something that's been very interesting to me, and it's something that I've been writing about and talking about, and actually we started a healthcare technology company to try to solve even before COVID started. So this idea of social distancing and social isolation has been on people's minds, really, especially since March 2020. But it's been a challenge that we've been dealing with, and it's been clear in the literature and in the research that this is what I've described as sort of the silent epidemic that we haven't really been aware of up until now, or at least the mainstream media hasn't picked it up. It's important because it touches literally every aspect of our health, our connection to others, our connection to people who we know will offer us support and offer us guidance, impacts not only brain health, but whole body health. And if you've paid attention to anything that Sharp Again has done over the years, it's very clear that brain health and neurological function and dementia prevention are a function of whole body health. We heard recently about those 4 pillars, right? Nutrition, sleep, exercise, and stress. I guess I would put this under the category of stress. So we're going to be talking a little bit here about the mechanisms involved in that. But before we do that, let's talk about just how much of a factor this is. Based on all of the existing research, the likelihood that someone would feel isolated, so perceived isolation, is very different from people who actually enjoy being alone and sort of gather their energy from alone time. Perceived isolation in the 1970s hovered around 11% of the population. In the 80s, that doubled to about 20%. There's some estimates that the most vulnerable population, which is seniors, AARP put out some research, I think it goes as far back as 2015. I would venture to say it's gotten a lot worse now. About 60% of seniors feel like they're not getting enough social connection, that they're not getting the social connection to the level that they require. And that's a challenge because we have an evolutionary need to connect with people. This is a quote at the top here from a researcher, probably the most prevalent researcher in this field. He's since passed, Dr. John Kachko, but he talked about evolution shaping the primitive human brain to desire and need social interaction in the same way that it shaped the brain to desire and need food. It's as essential for us to be around people as it is to gather food. That's changing these days, right? If you look at that statistic down there, Gen Z might be the most isolated generation that we have out there because technology, for all the good that it's done, has actually made things a lot worse. And I know we're going to touch on that a little bit later as well. In terms of health outcomes, again, brain health is whole body health. What we see is in the most isolated percentages of our population, there's a 29% higher likelihood of heart disease, 32% higher likelihood of stroke. Same thing for cancer. You see the statistic on dementia specifically, that after 10 years of isolation, risk of dementia, so that's converting from something like a mild cognitive impairment to a diagnosable dementia, goes up about 49%. It's as dangerous to feel lonely as it is to smoke 15 cigarettes per day in terms of health outcomes and mortality. It's 2 times more dangerous to feel lonely than it is to be obese. Suicide rates go up. So as you can see, it really runs the gamut on health outcomes. And as it relates specifically to dementia and Alzheimer's, I guess the best thing that I could share is a review of the reviews, a review of the literature that looked at all of the science up through 2018, combined 33 studies. And what they found was that if in people who are already at risk for all the other factors, there's 30 or 40 factors that might contribute to dementia, if we help people to get more socially and cognitively engaged, the possibility to prevent progression of Alzheimer's and dementia is actually quite high. So this was the conclusion from this literature review as far back as 2018. And I wanted to spend a little bit of time talking about why before we get into some of the strategies with Debbie as to how we might mitigate these effects. So there's this idea of social safety theory, the very idea that when we're surrounded by a group of people, again, we're tribal by nature, right? If we're amongst our tribe and we feel connected and supported, our bodies and our brains feel safer. And when our bodies and brains feel safer, I'm just going to skip over this slide. We can speak for a couple hours about Maslow, but in this context, I think we can skip over it. When our bodies and brains feel safer, it turns on less defensive mechanisms in our body. And so what are those defensive mechanisms? Well, they're the same factors that contribute to Alzheimer's. They are excess inflammation. Inflammation, we know, is at the root of most chronic diseases. They are oxidative stress. Oxidation is at the root of most chronic diseases. Blood sugar regulation. Our main stress hormone is called cortisol. When our cortisol is high, it spikes our blood sugar, or vice versa. When our blood sugar is low, it spikes our cortisol, and that activates our stress response. So being alone, feeling isolated, activates a lot of the physical systems, a lot of the aspects of our physiology and our biochemistry that predispose us to all kinds of chronic disease. When we look at the factors that contribute the most in terms of isolation and its likelihood of actually impacting Alzheimer's, there's three real categories that I like to talk about in terms of what loneliness does to us and how we engage with the world. Number one is this propensity for hypervigilance. You've probably all known this person, or maybe you are this person who, when you walk into the room and you say hello and they get startled, even though they really should have expected you to be there, this feeling of being constantly on edge and hypervigilant to the world does increase our stress response and our likelihood to deal with some kinds of chronic diseases. So working on that stress response is really important. However, the hypervigilant personality is also exacerbated by feelings of chronic loneliness. Similarly, when we feel lonely or isolated, it creates a little bit of a vicious cycle in some ways, because when we already feel lonely, we're less likely to seek out positive affirming stimuli, or less likely to get reward from seeing other people, and less likely to benefit from an understanding that if a person smiling at us is actually trying to help us. And we're more likely to sort of seek out things that are less supportive of our system. So this propensity for seeking out negativity versus positivity, also a hallmark of chronic loneliness. And then the last piece that I'll say, that's a hallmark of chronic loneliness, but an important factor to understand is that we don't really need a lot in terms of social connection to actually benefit from some of these things that we're going to talk about. The research really seems to show that it's not about the quantity of relationships, but it's about the quality. Is there 1, 2, 3 people in our lives we know that we can call? The example I give, if we know we have, surgery coming up and we don't know how to get home after that, who would we call? And really, it's important just to make sure we have that even small number of quality relationships, and that alone will mitigate any likelihood of feeling chronically lonely. The reason for that is isolation, just like anxiety, is an alarm signal for our brains. It tells us to activate. It tells us, well, I'm alone. Let's go back to that evolutionary context, and I'm out in the wilderness, and maybe there's a tiger that's coming out of the woods that's going to try to get me. Again, we said earlier, it's as dangerous to feel alone as it is to be without food or water, because if we don't have our tribe to protect us, that does activate these mechanisms. And so our bodies attempt to keep us safe, which, as I said earlier, is ultimately what drives our likelihood of turning things into chronic diseases. Our bodies attempt to keep us safe is not a mistake. It's an intentional act. And our bodies strain back with symptoms, which eventually lead to Alzheimer's. The evolutionary biological reason for this is that when we hear that tiger coming through the woods, it's safer for us to assume that it is actually a tiger and be wrong than vice versa, right? Than to assume there's nothing coming into the bush when we hear that crackling through the trees, and be wrong about that. And so when we feel lonely, when we feel isolated, we can often, unfortunately, live in this chronic fight, freeze, or flight stage. We see this also in people who deal with early childhood trauma, who deal with trauma later in life. Chronic isolation is another form of trauma in a lot of ways. And that's not all meant to be scary. It's meant to set the context for some of these actionable things that Debbie's going to talk to us all about. Because we know that there are, like I said, 30 or 40 factors that contribute to all kinds of dementia and cognitive decline, and that these factors take 2 to 3 decades to develop. We know from the research that once someone's dealing with memory issues, there's been, a couple of factors already going on. And yes, we have to consider cardiovascular health, proper sleep, and nutrition, and all these wonderful things. But the point of this presentation is to put a little bit of a spotlight on the role of social connection. And I want to just end with the impact or the scale of impact that working on some of these things can have. And it brings to mind areas of the world called blue zones. Blue zones are 6 regions of the world where researchers identified people who tend to live to be centenarians, tend to be to live to age 100 or more, disproportionate to the areas around them. And they researched, well, what is it about these populations? What is it about the environment around them, like the natural environment, but also their built environment? What is it about the way they eat, the way they move, the way they handle their stress, how they engage with others? And what they found, and this is just a little bit of a Venn diagram of 3 of these areas: Loma Linda, California; Sardinia, Italy; Okinawa, Japan. And what they found, if you look at the center of this Venn diagram, in terms of the 6 factors that all of these areas shared, we have family, not smoking, eating a mostly plant-based diet, moderate physical activity that's actually built into their daily lives, and it's not going to the gym 2 to 3 times a week, social engagement more broadly, and eating a lot of legumes, believe it or not, was a big factor here. Now, all of these other areas have their own factors. For example, Okinawa, Japan is famous for people not overeating. They tend to have this approach where you stop eating where you're 80% full. And there's a lot of research on longevity and brain science around caloric restriction and things like that. But 2 out of these 6 factors are connected to the quantity and quality of our social relationships. So that's where I want to sort of leave us with the potential impact. If we can make some of these small changes, add some legumes, add a healthy diet, and then feel connected to our to the people in our communities and to our families, it can have a real important impact. So community and tradition truly are medicine in this sense. And with that, I will pass it to Debbie.
Will unmute herself. Thank you so much, Dr. Kachko. So I'm a social worker. I look at the world through those eyes and through my work with older people. And people of all ages, younger people, older people, we are social beings. We are connected to each other. Most of us, the ability to survive and thrive comes from our being connected to other people. And we see this obviously at both ends of the spectrum, right? We see young children, babies, they would die without having other people to take care of them and interact with them. Older adults, as they grow older, if their needs change, they also, I have worked with some people who are completely dependent. So our connection and the quality of life really depends on our being able to connect. But this all happens at the same time that as we age, in many, many cases, and I really, really, really encourage you to read up a little bit on the blue zones, because it's absolutely fascinating that there are people that are living in deep into their 90s and even past 100 who have a beautiful life of community, of gathering together. And at the same time, they're not joining gyms, they're not, they're not runners, but they have a community. They share meals, they share time together. They do gardening together, which again is how they get a lot of their physical exercise in, and they eat well because their diet is just very different. They're eating things that they grow themselves. They're eating things that come within a small area of where it's grown, as opposed to us. We go to our supermarkets. It may be even our lovely Whole Foods, which I personally love that store, but yesterday I was shopping and I cannot tell you how many things I bought that came from Chile. That's a big distance. So again, some of the stuff that we, as we grow older, by definition, in many ways, we're more alone because there's a lot of losses, right? You think about it. Frequently, older adults have, in many cases, lost family and friends. I've had many people say to me, I'm the last man standing. My last sibling died 3 years ago. I'm the last one here. My husband died 10 years ago, or I was never married, or my friends, they've all died or moved elsewhere. Employment, right? How do we define ourselves frequently, right? If I meet someone, is the first thing that I say, hi, I'm Debbie Drelich. I'm a wife, I'm a mother to 4 children and 5 beautiful grandchildren, which is true. I'll tell you more about them if you want separately. But most likely, if you meet me, I would say, hi, I'm a social worker. I work with older adults and I try to help them have a good quality of life. So we identify ourselves through our work. What happens when that's gone? Again, major loss, major connection to other people that's lost, physical decline. I'm not a physician. Dr. Kachko could tell us way more, but physically we are all declining pretty much, right, from birth. And what I see as something very, very important is sometimes a feeling of a lack of purpose. Why get up in the morning? Why get dressed, right? And we saw this so much during COVID. Working at home is an awesome thing, and some people do that. They spend their whole lives working from home. I have a son-in-law. He works in IT. He's a really smart guy. He lives overseas. He has never worked in a real office. So for him, COVID did not feel like a big switch. For someone like myself, not being around people on let's say a regular basis, during the times that we had to transition more to virtual as much as we were able to, I was miserable. And the one thing that I said to myself was every day, have to get up, take a shower, put on clothing, not to attempt to do work in our pajamas, which I guess once in a while is okay. But as a general rule, it's just not, it takes away structure. And that's, again, been one of the major impacts of this pandemic. And at the same time, as Dr. Kachko shared, all of these factors increase our stress, right? Increase inflammation, again, which then leads to a whole host of diseases, which are very, they can be deadly. And we specifically are looking at brain health today. Next slide, Joan. Thank you. So the question is, how do we prevent the potential outcome of social isolation? Remember, not everyone who was isolated suffered cognitive decline, and even forgetting about COVID, right? Just in general. We think about people, I'm a New York City person, so, but I think about people who live in rural areas, for example. What's it like for them? Some people it's fine, some people it's not. And that's where we worry about their cognitive decline. Generally, people who engage in meaningful and productive activities, they're going to feel good, right? You think about if you've had a good day where you saw a friend, you spoke to a friend, maybe you were out working, maybe you helped somebody, you're going to feel really good. That's going to boost your mood. It's going to boost your serotonin, again, affecting your life. Having that sense of purpose makes a big difference. Frequently, people who engage in meaningful activities frequently wind up living with other people. They have other people in their lives, even if they're not living in the same home. And studies have shown that actual productive activities help people to maintain their well-being and even improve their cognitive function. So a while back, I had done some training in something called Montessori, which a lot of people know of related to children. There are these Montessori education programs, but some of those same concepts were transitioned towards working with older adults, specifically in assisted living facilities or at home with caregivers. And one of the biggest losses that many older adults identify is that, I don't want to go to a senior center and sit and play bingo. I have nothing against bingo, by the way. Bingo, I know some people enjoy it. It's great if it gets people out, gets them together. But you know what? If I had a choice of going to play bingo or maybe volunteering at a soup kitchen, for me, I would feel better. And that kind of productive activity would probably help my cognitive functioning as an older adult as well. So again, meaningful activities. So Montessori actually turned a lot of the rules that we know of related to education on its head. Actually, pardon that pun. With the fear, like with young children, with older adults with cognitive loss is, well, they can't do anything for themselves, and we have to take care of them because it's going to take us longer, or it'll be dangerous if you give someone a knife to cut up a salad. Well, I would say maybe the opposite. You will help increase their stimulation and in their brain and their ability to feel like they're doing something productive. Now, I'm not saying I would not necessarily give my sharpest knife in my kitchen to all of my clients, would not be capable of doing that, but with proper supervision, I think many of them could perform little tasks. And how wonderful does that feel to know, hey, this is a salad that I made, as opposed to I'm being taken care of 24 hours a day. So it really makes a big difference and helps, I believe, improve cognitive functioning. And we do believe very strongly that the brain can, even in spite of whatever damage, whether it's from Alzheimer's disease or other dementias, we feel that the brain has a certain amount of neuroplasticity, that parts of it can still keep growing. And that's why we encourage people to join our Sharp Again programs. Little plug there. Next slide, please. So the $54,000 question, what can be done? Next slide. Okay, so the big question is, how can we connect even when we are apart? Does it mean that if we are isolating due to the latest variant of COVID and not wanting to go out and see people, or not wanting to go to family functions because perhaps younger adults in our life maybe aren't as cautious as we are? Does it mean there's no other way to connect? We have to be open sometimes to other ways of communication and connection, which I think for many people, it wasn't a possibility. It wasn't an interest of theirs until the choices were taken away from them because of COVID, for example. In many cases, because of perhaps becoming more socially isolated due to physical frailty. I think of one of my clients who is 97 years old, and she was living in the same apartment in Chelsea, Lower Manhattan, for, I have to do the math on this one. She moved there with her parents when she was 12. And so she lived from the age of 12 until the age of 95, when she really had a major stroke. 4th floor of a walk-up. Can you imagine? 4th floor of a walk-up. She had not, when I first met her, she had not been out of her apartment for a year and a half. And this is the most chatty, communicative person, loves to sing, happy person. Eventually, her family made a decision, her niece and nephew who live on the West Coast, that it was time for her to move. She had, unfortunately, a serious stroke. But we connected her with a lovely program in Manhattan called Dorot, where they actually have classes on the telephone. And it took a lot of coaxing to get her to agree to it, but she participated. Now, of course, so many people have iPads, right, or other tablets and devices. So again, we have to be open. How else can we connect when we're apart? Well, being present. Sounds kind of crazy, right? You have to be present when you're speaking with others. We live in a world that values multitasking. And when we multitask, sometimes we may be physically sitting here, but our mind is in 6 other places. Guess what? We're not doing a good job of being in those 6 other places. And we're surely not doing a good job of being present when we're speaking with others, whether it's by phone, whether it's on Zoom, like today. And even through those other ways of communicating, our shared experiences that we have will make us stronger. So sure, is it great to be able to be together? And I wish that we could be together today, that we could, be in the same space. But this, I think, is probably the next best thing. It makes us stronger when we share experiences. Next slide, please. Okay, so I thought this was kind of a neat slide, and I wanted to share it. This was from the NIA. It said that this was their tips, kind of a short list, which is kind of a good thing, to how do you protect your brain from the negative effects of loneliness and social isolation. So again, real specific, not necessarily just your body, but your brain. Number 1, stay active and connect with others, whatever form that may be. Maybe that is going out and taking a walk around the block with your neighbor. Because remember, your neighbor is also as socially isolated as you are at times. Schedule time each day to connect, whether it's in person, by phone, email, video, social media, whatever it may be. And again, remember I mentioned about keeping a schedule. So even in the heart of the pandemic, I personally fought myself not to do work in pajamas because I just felt I needed to have a schedule, to maintain a schedule, even though my world and the rest of the world was turned upside down. Restart an old hobby or take on something new. There's something actually, my 11-year-old granddaughter who resides in Jerusalem, Israel, sent me a link to something called Duolingo. Duolingo is, you can actually learn, it's a free app that you can learn another language. I don't know, maybe she's embarrassed when I comment my Hebrew is not as good as it could be, but she was like, Savta, which means grandma, you're gonna sound like a native. Trust me, do this. I have done it occasionally. It's great for the brain though, to learn another language. Take a class, whatever it is. Maybe it's something new. Go take origami, take chair yoga, whatever it may be. Sign up, as I said, for something local, right? Local public library, community centers, Dorot, volunteer to help others. Something that I have been very proud of my home city of New York City is that when I went to see, and I still go to see clients in their homes, especially in the heart of the pandemic, there were beautiful notes that were posted of people in the buildings saying, if anyone has a hard time going to the store, please call Susie in, apartment 6D at such and such a number. I'd be happy to help you. Little measures, little kindnesses. Adopt a pet if you can. Maybe it will force you again physically to go out, to have to walk it, to care for it, to think about something else other than misery and loneliness. And next slide. These I thought were nice tips. I like them. Okay. Technology has been a great way to prevent people near and far from cognitive decline. I've seen a lot of programs even offered for patients with dementia, run by all sorts of organizations that offer concerts and activity programs so that when people weren't going out, they were at least able to hear music, which they enjoy and brings them joy. Do things that bring you joy. There are a number of programs actually that are out there that are intergenerational, which is also really beautiful. I once had a client who was 94 when I met her, and she had been a piano teacher. And unfortunately, her husband had just died, and they had had kids, and very sad life. Her kids had passed away years before. And but she was the most positive person I'd ever met. And she had a lot of physical ailments that walking, she could not do without someone holding her, basically. And I said, what is your secret to successful aging? I ask a lot of older people when I meet them this, older adults, because I've heard some beautiful things. Hers was the most beautiful, and it's stuck with me for many years. I guess as I get older, I think this way as well now, is connect yourself with people of all ages. She said to me, she said, listen, if I would have only been friends with people my age or older, I would be isolated and alone. She said, I have tried to surround myself with people that I've met, whether it's former piano students of mine that I stayed in touch with, that I invite over for Thanksgiving dinner, or any other type of activity to involve different people. Telemedicine, something else that's been absolutely amazing. I imagine, Dr. Kachko, you probably use that in your practice for people who weren't able or willing or were fearful, or the doctor's offices were closed. Very important, has made a big difference. Brain games, Luminosity, Brain HQ. These are things that are free or very inexpensive to enhance cognitive functioning. Next slide, please. But then there's some limitations, right? Accessibility and availability. Not everyone feels comfortable with using an iPad, right? Or a desktop or a laptop. Cost, right? A nice iPad is a few $100. Like over engagement with the internet and social media also leads to stress and depression. I kind of like this picture of this guy. Again, real connection to real people, if you can, to supplement it is really crucial. Next slide. As I mentioned, the routine, even when isolated for brain and body health, keep a sleep-wake schedule, whatever it is. So, don't be tempted to say, oh, I don't have to leave the house today until 12 o'clock. I'm going to sleep until 11. Maintaining, again, your proper nutrition, hydration, hygiene, keep those routines going, whatever they are, is so crucial for your brain health, even when isolated. Next slide. So we would like to open up. Joan, you are our mistress of questions. Do we have any questions? Would anyone like to ask us anything? Okay.
Sorry.
Microphone's on now. Could I make a comment?
You're most welcome.
After my wife and I have owned athletic clubs for 50 years now. And I just wanted to point out that for so many seniors, we become a center in our community. And for so many seniors, we are their social contact. They come in, particularly as they age, and slow down. They don't do as much, maybe walk on the treadmill, watch some TV, or we have a movie theater with treadmills in it. So I know people who are not gym goers sometimes think it's all nothing but kids, but many of our facilities are really focused, many facilities through the country, on a younger population, but the ones that have been around like we have really welcome everyone and have really become a center for contact for many of our members. And I give this lecture to our staff regularly. We are the social contact for many of our seniors who have lost all their family, and their friends are all with us. So they can be part of that social network, and they shouldn't be disparaged as something that nobody has to do.
That's a great comment. And I would just add, the best kinds of learning for the brain in terms of prevention of cognitive decline is coordination of movement and sort of the mental capacity to understand that. And so learning dance, but also exercise. Exercise from a brain perspective is much more than just a physical activity. It's this coordination of movement that is a whole body and brain process. So I would just, I would second that anytime we can get ourselves to be engaged in that way, it's going to be helpful.
And of course, to help prevent that isolation is crucial. It's so, I mean, when you see the same people in the gym, you do develop a certain connection to them, and
Absolutely, yeah.
it's great. It's really great.
Do
Some
we
of
have
them,
any other questions? Sorry.
Well, I'd like to just mention that I'd like to encourage everyone to learn more about Sharp Again by going to our website, because there's an abundance of information that you may find helpful about brain health, prevention of dementia, reversal of dementia, and so many interesting topics, all available. We have our small groups, which I know we shared earlier, and we encourage you to kind of take it to the next level. It's a very nice, intimate group where we have health coaches who are facilitators, who are sharing important information, turning around your life, and utilizing some of the protocols that we suggest can feel a little bit unyieldy if you're doing it on your own. But having a coach and having, again, a group, right? A shared group, a shared experience makes all the difference. So we encourage you. We encourage you to check out all the great resources, and there will be more interesting seminars being offered. Get a lot of feedback there. Well,
Can you hear me?
Yes.
Damn.
Go ahead. Is there another question?
I don't see any additional questions in the chat box.
well, then we really would like to thank you for joining us today,
I just took it off.
and encourage you to do the very best you can to stay connected with people, as one of the measurable ways to prevent and to enhance brain health. So I thank you for joining us.
I think maybe my technical difficulties are a little bit better. Am I not so echoey?
No echo now.
Okay. I will be sending out a link with the recording, along with Dr. Kachko's and Debbie Drelich's contact information, and perhaps a few resources from that were mentioned in the video, in the presentation, along with some a link about our programs. So I want to thank you, Dr. Kachko and Debbie, for joining us. It was a wonderful presentation.
Thank you for having us.
Thank you so much. We really appreciate the information.
Thank you.
Thank you. Have a wonderful day, everybody.
Thank you.
Bye-bye. Hope you feel better.
Yes.
Okay.
Speedy recovery.
Stay with it. Okay. Bye.
Bye-bye.